Okay. For bite registration, what you need is you need the extruder gun, okay? And there's the ones that say aqua or jet bite, okay? So this is where you would load, lift, and load the cartridge. In the back is a button where you would release, push up, so that you can pull back, okay? And the size that we're using, notice that both of these, one's fairly bigger than the other, but they're pretty big. There's also another one that has a small one, and that's not the one you want, okay? Of course, you have your bite registration in a cartridge, 2 different materials. It gets activated once you put it in, and you have your 2 tips. I personally always have an extra tip on the tray just in case, or off to the side on a paper and towel in case it doesn't work or some sort like that, okay? I'll also be showing you the video that Dr. Eck made when he did his bite registration, okay? You always, of course, you would have your gloves on. I don't have my gloves on, but I'm just showing you the material first, okay? You would always bleed, you engage, you put it in, you lock it, you engage. You're gonna bleed just a little bit, not the entire thing. You wanna make sure that both of the materials come out, okay? And at that point is when you put your tip on. Notice that there's a little V gap in there, and this is where you match up the little positive and the negative, so to speak, female, male, put it in, and you turn it. It's very important that you turn it. If you don't turn it, then it could pop off. Then you're ready to take the bite registration, okay? I'm going to show you one thing really quick before we get a demo on this. I'm going to turn this over here. What's important to know about when you're doing your bite registration, and Ms. Gonzalez will demo for us, is that you always want to start in the posterior in the back if you're doing a full arch, okay? You start in the back, okay? Before you even go in there with the bite registration though, you always want to ask the patient to bite down for you and smile, because what you're looking for is to see where their canines bite. How do they normally bite down? Because that's going to be an indication for you that when you're doing the bite registration that they're actually biting down the right way, because they have a tendency to change the way they bite because you're putting something in. Okay, a given would be that you always explain the procedure for them, that it's not going to, they're not going to feel any discomfort. It's just basically taking a bite registration of the upper and the lower dentitions, okay? It hardens really fast. So again, you start in the back and you kind of do a little zigzag motion, and Mrs. Gonzalez will demo for us. It's when you get to the front is when you feel like, oh, I gotta stop, it doesn't come out anymore. That's when you have to continue to crank it. You wanna do here again, and then continue on to the back, okay? And then kind of wipe off the tip inside there, because if you have a tendency and you wanna just, okay, I'm finished, I'm gonna lift it up. Well, you're gonna bring all the material up for you from the teeth, and it's gonna come with you. Okay? Once you have it down, you tell them to bite down right away, because remember, this side's already been activated, so it's already starting to harden. You have fast working time here, okay? Have them bite down and hold it until you're ready, until you test the material and you feel that it's ready, okay?